Imagine losing muscle strength day by day, struggling with simple movements, feeling your body weaken without control. What if your muscles couldn't repair themselves? What if the condition had no cure? But there are ways to slow it down, improve function, and even regain that strength. That's exactly what we're uncovering today. Welcome to Levitas. What is muscular dystrophy? Muscular dystrophy, also known as MD, is a group of genetic disorders that cause progressive muscle weakness and degeneration. Over time, the muscles lose their ability to regenerate, leading to reduced mobility, weakness, and disability. Muscular dystrophy affects millions worldwide, with Duchenne muscular dystrophy, known as DMD, being the most common and primarily affecting children. Other types, like Becker muscular dystrophy or BMD and myotonic dystrophy, affect both children and adults. While some types cause mild symptoms, others lead to severe disability and early mortality. Despite its progressive nature, research shows that certain treatments, lifestyle changes, and supplements can help slow down muscle loss and improve quality of life. What causes muscular dystrophy? Muscular dystrophy is caused by genetic mutations that interfere with protein production, particularly dystrophin, which is crucial for muscle strength and repair. Without it, muscles deteriorate over time. There are many types of muscular dystrophy, but the most common include Duchenne muscular dystrophy, which is the most severe form, affecting boys and causing rapid muscle loss. Becker muscular dystrophy, which is similar to DMD but less severe and progresses slower. Myotonic muscular dystrophy that affects muscles and organs, causing prolonged muscle stiffness. Limb-girdle muscular dystrophy, which weakens hip and shoulder muscles, making movement difficult. Facioscapulohumeral muscular dystrophy that affects face, shoulder, and upper arm muscles. Each type varies in severity, but all lead to muscle weakness and mobility loss. What are the main symptoms? The main symptoms of muscular dystrophy include muscle weakness, which starts in the legs, arms, or face, progressing over time. Difficulty walking that leads to frequent falls, trouble climbing stairs, and instability. Muscle wasting, since muscles shrink due to inability to regenerate properly. Joint stiffness and contractures, and tightened muscles and joints cause limited movement. Breathing difficulties, since weakness in respiratory muscles leads to shortness of breath. Heart problems, due to the fact that some forms of MD affect the heart muscle, leading to cardiac complications. Speech and swallowing difficulties, as throat muscles weaken, eating and speaking become harder. These symptoms occur due to a lack of dystrophin, a protein essential for muscle repair. Without it, muscle fibers break down, causing degeneration and inflammation. Over time, the body struggles to replace lost muscle tissue, leading to weakness and disability. Although muscular dystrophy is progressive, early interventions can help slow muscle loss and maintain function. Who is at risk? Muscular dystrophy is genetic, meaning it runs in families. Males are at higher risk, especially for Duchenne and Becker muscular dystrophy, because the mutation occurs on the X chromosome. Other risk factors include family history. If a parent carries the gene, there's a high chance of passing it to children. Genetic mutations, in some cases, occur spontaneously without family history, and age, since some forms appear in childhood, like Duchenne muscular dystrophy and Becker muscular dystrophy, while others develop later in life, like myotonic muscular dystrophy and limb-girdle muscular dystrophy. Although no one can change their genetic makeup, proper diet, physical therapy, and supplements can help manage symptoms and improve muscle function. How fast does it evolve? Muscular dystrophy progresses at different rates depending on the type and the person. In Duchenne muscular dystrophy, symptoms appear by age 2 to 5, with most patients needing a wheelchair by their teens. The Becker muscular dystrophy progresses slower, with symptoms emerging in the teen years or early adulthood. In myotonic muscular dystrophy, symptoms appear in adulthood, affecting both muscles and organs over time. For both limb-girdle and facioscapulohumeral muscular dystrophy, progression varies but usually affects mobility within decades. While some forms lead to severe disability within years, others progress slowly over decades. Early intervention with physical therapy, a healthy food plan, and supplements can delay muscle loss and preserve strength. What are the worst complications? The complications of muscular dystrophy can be life-threatening, including loss of mobility, since many patients become wheelchair-dependent as muscles weaken. Respiratory failure, since weakened diaphragm muscles make breathing difficult, sometimes requiring ventilators. Heart disease like cardiomyopathy is a leading cause of death in some muscular dystrophy types. Swallowing difficulties, which increase the risk of choking and malnutrition. Chronic pain and joint contractures that causes severe stiffness and discomfort. Managing complications early can help improve quality of life and extend lifespan. How to treat this issue? While there is no cure, several treatments can slow progression and improve muscle health. Supplements that support muscle health include coenzyme Q10, that boosts cellular energy and muscle endurance. Vitamin D plus K2, which support bone strength and muscle function. Omega-3 fatty acids, which reduce inflammation and supports heart health. Magnesium helps to prevent muscle cramps and stiffness. Creatine is a powerful enhancer of muscle strength and recovery. Selenium helps to reduce oxidative stress in muscles. Vitamin E, which protects muscle cells from damage. Curcumin and green tea extract are natural and very effective anti-inflammatory agents. Combining these with physical therapy, a high-protein diet, and exercise can help maintain strength and slow the progression. How can you diagnose this issue? Diagnosing muscular dystrophy involves several tests, including genetic testing, which identifies specific mutations, muscle biopsies that examine muscle tissue for abnormalities, electromyography, also known as EMG, which helps to test muscle function, creatine kinase blood test to measure muscle damage markers, MRI and CT scans, which help reveal muscle degeneration patterns. Early diagnosis allows for better treatment and management strategies to improve long-term outcomes. In conclusion, muscular dystrophy, or MD, is a genetic condition that causes progressive muscle weakness and degeneration. Over time, the muscles lose their ability to regenerate, leading to reduced mobility, disability, and serious complications. Although there is no cure, early intervention, lifestyle changes, and targeted supplementation can slow its progression and improve quality of life. The cause of muscular dystrophy lies in genetic mutations that interfere with dystrophin production, a key protein for muscle strength and repair. Without it, muscle fibers deteriorate, leading to chronic weakness. Different types of muscular dystrophy, such as Duchenne, known as DMD, Becker, or BMD, myotonic, limb girdle, and facioscapulohumeral muscular dystrophy, vary in severity, but all lead to progressive muscle loss. The main symptoms include muscle weakness, difficulty walking, muscle wasting, joint stiffness, breathing issues, heart complications, and trouble swallowing. These arise from the body's inability to repair damaged muscle fibers, leading to chronic degeneration and functional decline. Those most at risk are individuals with a family history of muscular dystrophy, particularly males, since some forms are X-linked disorders. However, spontaneous genetic mutations can also cause muscular dystrophy, meaning even those without a family history can develop the condition. The progression rate varies. Duchenne muscular dystrophy advances rapidly, while Becker and other forms progress more slowly. Some patients lose mobility within years, while others experience gradual muscle decline over decades. The most serious complications include loss of mobility, respiratory failure, heart disease, and chronic pain, making early intervention essential. While there is no cure, certain supplements like coenzyme Q10, vitamin D3 with K2, omega-3, magnesium, creatine, selenium, vitamin E, curcumin, and green tea extract can support muscle health and slow degeneration. Accurate diagnosis through genetic testing, muscle biopsy, electromyography, blood tests, MRI, and CT scans ensures early management and better outcomes. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.